Hello, it's Dr. Rhonda Johnson. Today is Saturday, February 3rd, 2024, and today I'm talking about the flu. Well, flu cases are up in many areas across the United States, according to the CDC. Clinical lab tests with positive flu results are up 16.2%, with most of the flu tests showing influenza A viruses. Now, the CDC estimates that just this flu season, there have been over 16 million flu cases, 180,000 flu hospitalizations, and 11,000 deaths from flu so far. Now, the number of flu cases are going up, but sadly, the number of people who have received a flu vaccine is down this year. Now, I used to get my flu shot at work, but since the COVID-19 pandemic, I got my flu shot at the neighborhood pharmacy where I live. So remember that you can get your flu shot at your doctor's office, but you can also get a flu shot at most retail pharmacies. Many will do you on a walk-in basis. Now, Black children and adults continue to have the lowest flu vaccine coverage compared to with all other race and ethnicity groups. Now, there is a lot of misconception about the flu vaccine. I do a lot of community education, and this is what I've heard over the years is that, why should I get a flu shot when it doesn't stop me from getting the flu? Well, again, getting the flu shot may not stop you from getting the flu, but it will lower your risk of hospitalization and death. Studies have shown that people who've gotten the flu vaccine are 59% less likely to end up in the ICU from the flu illness. Other things I've heard is that I've heard the flu shot gives you the flu. Well, that is not true. Most people get the flu injection, which is a killed viral vaccine. The only live virus is the flu nasal spray. It's called flu mist. And people who are pregnant should never get the live flu viral vaccine, and most people get the shot. They don't get the nasal spray. I've heard people tell me, well, I've gotten that flu shot before and I still came down with the flu. Well, that's possible. If you've, let's say, got the flu shot today, but you were exposed 2 to 3 days ago to somebody with the flu and they sneezed or coughed and passed it on to you, well, that flu virus is replicating in your body. It takes 2 weeks for the flu shot to work, so it is possible you got that flu shot and still came down with the flu. Now, I also hear, well, it's too late to get a flu shot. Aren't you supposed to get that in September? Well, I know it's February 3rd, but folks, it is not too late to get a flu shot. Other concerns I hear is that the people are concerned that the flu vaccine isn't safe. Well, for most people, it is safe unless you've had a severe allergic reaction to the flu vaccine in the past, or you've had a history of Guillain-Barré syndrome. The flu vaccine is recommended for most people 6 months and older. So another thing I hear, well, aren't COVID and flu related? Well, they can cause similar symptoms, but folks, these are two different viruses. And to lower your risk of getting COVID and the flu, again, you're getting complications from COVID and the flu, you should get the flu shot and the updated COVID vaccine. So who's most at risk for complications from the flu? Well, people who are 65 years and older, younger children that are younger than 5, but especially children younger than 2, and people of any age with chronic medical conditions such as asthma, diabetes, heart disease, kidney disease, any type of lung disease, cancer, or any immunocompromised state. Now, word about pregnant people. Pregnant people are at a higher risk of developing serious flu complications. Remember that vaccination during pregnancy not only protects the pregnant person, but also protects their baby for several months after birth. So in closing, my key points are it's not too late to get that flu shot. Talk to your doctor if you have any questions. Flu season is ramping up, not trending down in a lot of places. And young children, pregnant people, people 65 and older, and those with chronic conditions are at highest risk for the flu complications. That's my message today. I hope it helps you if you're thinking about whether or not you should get the flu shot. Please pass this message along, share it with someone that you think needs to hear it. Take care, folks.